Nobody should have to fight cancer and their congressman at the same time. We shouldn't have to fight for our basic needs and for our health to get better, right? And people also shouldn't have to worry about going tens or hundreds of thousands of dollars into debt just to get better, right? We need people to have the health care that they deserve, and we need to fight for Medicare for all. There's no other way that we can continue to have a system that prioritizes the profits of health insurance companies and big pharma and CEOs on the pain and suffering on the backs of our families. We deserve better here in the Valley and across the country.
Welcome to the very first episode of Left Coast. My name is Jane Kim. I'm the California Director of Working Families Party, and this is a new podcast where we'll go behind the news in California politics and talk to real people making changes across California. For this first episode, I'll be interviewing Randy Villegas, who's running for Congress in a Central Valley swing district that, thanks to Prop 50, is now one of the most competitive in the country. Randy was just endorsed by both Senator Bernie Sanders and Dolores Huerta, the co-founder of United Farm Workers, and we are so excited for this conversation and his campaign, both of which focus on Medicare for all, an issue that we care dearly about and are fighting for. Joining me to talk about this and other news from the Left Coast is registered nurse with the California Nurses Association, political organizer with the Harvey Milk Club, and all-around badass, Syd Simpson. Welcome, Syd.
Thank you. Thank you so much for having me.
Well, I think it's important as we talk about Medicare for all to have someone who actually works inside the healthcare system talk about, why this is so important, right? I mean, I think all of us understand that everyone should have access to healthcare, that it should be affordable, that in the wealthiest country in the world, no one should be denied healthcare at any point, at any time. But as someone who's working on the inside, why does Medicare for all matter to you?
Yeah, thanks for that. As a nurse, for sure, we get a front seat every day to the complexities of the system. Patients struggle with things like gaps in coverage, surprise bills, totally unaffordable copays, just all the complexities of our current system that lead people to say the system is broken. We sort of see that every single day. And I work for a healthcare giant. So a lot of the patients I see are in fact insured. So, we have close to, like 20, I think the number I saw is 27 million uninsured people in the US. That's over 3 million in California.
And I think it's important to also talk about the price that we already pay, right? We are in a system that is one of the most expensive in the world, yet provides the least care of all wealthy nations. And we've seen the stats. Private health care costs usually 3 times on average what Medicare costs. And Kaiser is 3.7 times Medicare. And there are hospitals that charge 4 times as much as Medicare does. And so how does this impact patients that you get to see? What are some particular stories that Medicare for all would make a difference in?
I often get to sit at the front desk and where patients check in, and that is where they are confronted. Sometimes it seems like, for the first time with what their copay is going to be. And in that moment, I see people make the decision of whether or not they're going to get this scan or this procedure based on what their copay is. So again, I've seen people walk out of the waiting room who are there to get a CT scan to find out if they potentially have cancer, or they have a confirmed cancer and they're there for a procedure to treat that cancer and they have to walk out because they can't afford their copay. It's hard to talk about, but I've had patients who opt to have procedures without sedation because they can't afford the sedation fee, stuff like that. It's just, and again, these are insured patients. So it's hard to watch. And then just like personal anecdotes, I'll say I have a family member who is an attorney but was changing jobs between jobs. So it had a gap in coverage, had a dental emergency, had to go to the emergency room, and called me essentially because in this gap in coverage, right, we're paying for everything out of pocket. So in that moment, when the emergency room physician wants to do a CT scan and potentially a procedure to drain, we have to talk about what are some ways we can mitigate some of these costs, because this is a potentially life-altering financial burden happening in this moment in the emergency department. For, again, for a person who had insurance a month ago, will have insurance next month. These are not people who irresponsible people or anything like that. People want health insurance. They want to go to the doctor. They want to, be healthy. We are just making it so, so hard. I have anecdotes on anecdotes, but I know everyone does. At this point, people have seen behind the curtain, and you either have experienced how broken the system is, or someone who has experienced how broken the system is. And if you haven't, you are lucky, and I hope it stays that way. But it will eventually affect all of us, unfortunately.
So we've had an incredible roller coaster of a month, starting with Election Day, when we had huge victories across the country, from Zoran Mondani's win for New York City mayor, a Working Families Party candidate, to Katie Wilson, who took on an incumbent in the city of Seattle as a first-time candidate and also won, down to Prop 50 in California, where we had a landslide victory. 64% of Californians said yes to Prop 50, and countering the cheat that President Trump and his friends in Texas tried to put into place, because they know that their policies aren't popular, so they're trying to cheat their way to a win in 2026. And California said, we're drawing the line, and we're drawing the line in California. Now, fast forward 7 days, and 8 Democratic senators cave in the longest shutdown fight in our history, which was a fight centered around ensuring that millions of Americans continue to have access to affordable health care. What was it like to go into the hospital the next morning? What was the reaction? What was the mood?
I was with a group of union nurse leaders. So we're a crowd that was following this very closely. And I would say it was a mix of grief, this is profoundly sad, and anger, the battle axe nurses are just mad as hell, understandably. We had so much momentum, there was such a week of joy after Zoran and Katie Wilson. Oh my gosh, everybody's so excited. And then for them to just absolutely suck the air out of the room like that was something else. Really disappointing.
It was so disappointing. And we won 2 women Democratic governors in New Jersey and Virginia, which is hardly the bastion of progressive politics. It was just so demoralizing to have this great win and to not have it continue to be leveraged. And, I should also mention that Prop 50 did incredibly well in California, but it in particular did well with young voters, with voters that make under $30,000. We saw that 71% of voters that make under $30,000 supported Prop 50. 71% of all voters of color, Black, Latino, Asians, voted yes on Prop 50. And we won counties in Central Valley that Trump won in 2024, like Fresno, Merced, and San Joaquin. And Randy Villegas, who is one of our Working Family Party champion, he's a school board member on the Visalia School Board, is in the Central Valley, which is a region that is a battleground for all of us. And what would it mean for you, both as California citizen and as a Working Families Party member, to see someone like Randy advance into Congress?
Yeah, I think any opportunity for a memorandum on these corporate Democrats is it's invigorating. It's a huge win for us. That's why I'm here. That's why I'm with WFP, because it's no longer about Republicans versus Democrats. We have to come after these corporate Democrats that are, essentially accepting money from the same places as these Republicans are, right? It's a new age. It's a new age, and I think people are hip to it. I know for sure in California, people are hip to it. Just because you have a D beside your name does not mean you are for us. So I really appreciate that number you just mentioned, people making under $30,000. I love to hear that those folks are activated, because I don't know if y'all have heard, I don't know if you've heard this. I've heard people starting to say you're either working class or Epstein class. And I love that class solidarity, I love to see people excited to vote. And I really appreciate that Prop 50 excited so many people. People were pumped to vote for it. It was, it's another, I love when voting is exciting.
It is amazing when our communities come together, because the joke always is there is class solidarity, but it's actually amongst the billionaires.
Yes.
They very much back each other up. And in order for us to fight the few billionaires who are very unified in consolidating power and resources, we as the masses must unify. And you brought up taking on establishment politicians. And at Working Families, we don't distinguish between Democrats and Republicans. We distinguish between candidates who are going to fight for the billionaires or are going to fight for us, right?
Hell yeah.
And Randy is running against both an establishment Democrat and an establishment Republican who are taking money from the same billionaire corporations like Big Pharma. Neither of them have come out in support of Medicare for all. Randy's the only candidate that's doing that today. And, recently he, as I mentioned in my intro, he earned the endorsement of Senator Bernie Sanders and Dolores Huerta, who is a civil rights icon in California, worked very closely with Cesar Chavez to organize farm workers in the Central Valley. It's just exciting.
Actual labor rock star.
Yes. So it's exciting to see the momentum that Randy's building. And what is also something that I learned during his campaign is that the average voter in his district is 30 years old and Latino. And Randy just turned 31. So he actually is representative of the median voter in his district.
That's amazing, and I feel old.
But this is how we win, right? I think the Democratic strategy of just running a candidate just to the left of the Republican is why we're losing. That's not going to turn out young voters the way Zoran Mondani is on a platform of free buses, freezing the rent, and community grocery stores, right? That strategy of just running to the left of the Republican is a losing strategy. And so to have this opportunity to run an unapologetic candidate from the community that looks like the community and is going to fight for Medicare for all is, I think, the type of candidacy we need to see across the country.
Definitely. This goes into that whole progressives. They're not going to turn out just to vote for someone who's not a Republican. The problem we have is if there's no one inspiring, if there's no one inspirational to vote for, they just, especially young people just won't show up to vote at all. And that's Zoran's win, right? The turnout was shocking. So if we can get some inspirational folks who are not just to the left of the Republican, it's the inspiration that we need for the turnout to really win these big ones.
I haven't looked over all of the data from the most recent general election in New York City, but I remember looking through the New York City primary results, and it was the first time we've seen voters under 35 outnumber voters in every other age group, which is just extraordinary. And
that's pretty
this
cool.
week,
I also saw something which I think I read this right, but it said that Zoran got more votes on the WFP ballot line than there were Republican votes total. Is that right?
That's right.
New York?
That's right. It was historic.
That is,
cool. And so for some of our viewers that are unfamiliar with New York's electoral system, New York has something called fusion voting, which allows candidates to run under multiple ballot lines. And Working Families Party is an actual ballot line party in the state of New York. Zoran's name came up twice on the ballot, both as the Democratic Party nominee since he won that primary in June, and he also showed up as a Working Families Party Democrat. And he wasn't the only one. Other candidates also won under more than one party. And that's how Andrew Cuomo showed up on the ballot again after losing the Democratic Party, because he had already accepted another party nomination back in April of this year. But to go back to what it takes to win, when I worked statewide for Bernie 2020, we were shocked to see the election results. Bernie won and came in first place in 47 out of 53 congressional districts in California, including in the Central Valley, including in the district that Randy Villegas is running in, on an unapologetic platform of Medicare for all, tuition-free public college, raising the minimum wage. This is a platform that is popular in red, purple, and blue districts across California. And that was when I realized that actually our electorate is far to the left of our elected officials. And that's why I'm so excited about what we're building here at Working Families Party, but also what movement we see happening in 2025. So let's talk about the incumbent that Randy is running against, Valadao, who actually voted for the big bullshit bill that is cutting healthcare to thousands of his constituents. In fact, they have one of the highest rates of Medicaid and Medicare patients in the state of California. What's also crazy is that the Democrat that he's running against, who's a doctor, keep in mind, refused to vote against a buffer between new fracking and schools, playgrounds, and residential homes, was absent on the vote to regulate pesticides in her very own community, and continues to take money and is proud to take money from big oil like Chevron and Western Petroleum, and has defended that, continues to take money from Big Pharma. And so we'll have these two candidates that will barely be able to differentiate themselves to voters, despite having a D and an R next to their name. And what I'm hopeful for is seeing someone like Randy, who's willing to fight for the community, go out there and door knock. The problem, of course, is he's not going to have the money that the other two candidates are going to have. So he's going to have to work extra hard to get his name out there. Because as you and I both know, it's not enough just to have a candidate that stands with their values if the voters don't know who they are. And often money is the resource by which we get people's names at the door so that they vote.
It's true. Yeah, you have to have money or labor. So that's where the door knocking, that's where the canvassing, the phone banking, the text banking, all that stuff becomes super important. So that's why I love to spend my free time doing as much phone banking as possible. Yeah, it makes sense, right? If you're not taking oil money, you're likely not going to have as much money as your competitor. But God, Democrats taking oil money, it's just like, I'm so sick of hearing it at this point. And a doctor at that, like, I don't even know what to do with that in my brain, honestly.
And it's not just Democratic candidates that take money from big oil. The California Democratic Party takes money from big oil, refuses to stop taking money from oil entities like Chevron. And Chevron, by the way, is the #1 political spender in the state of California, more than any other entity. And that's something that I think a lot of Californians don't realize.
I didn't know
that we're a super blue state, that we're a super liberal state, that we're advancing on a lot of climate justice policies ahead of others. And we are to a certain extent. But again, big oil is the #1 political spender in California, and they do it because it works. They're not throwing money away. They're spending money because it works. So while we've made some advances on climate justice, we haven't gone as far as I believe our electorate wants us to go because of all of that money that comes into the political system.
I didn't know that about Chevron, but I guess I shouldn't be surprised. Same with the big pharma stuff, right? Again, why do we not have regulations around this? This is a doctor taking big pharma money. Come on. Yeah, you're right. When you think about California, you think like environmental justice, climate justice, but man, if we could get these barriers out of the way, and that is these like corporate lobbyists lobbying against our interests, it would be so exciting to see what we could get done here in California. We're so close.
This is why I've always really respected California Nurses Association and CNA, because they backed Bernie Sanders before he was a viable candidate in 2015. They were also one of the few unions and entity that came out in support of campaign finance reform laws in the state of California to curtail the power of big political spenders from billionaire corporations like big oil, but also like big pharma and big private health insurance industry. Another stat that I heard recently that really shocked me was the amount of money the average employers spent on healthcare on behalf of their workers. It's an average of close to $2,000 a month. So if we think about that from 2021 to 2025, just the last 4 years, that's $265 that employers could have been paying directly to their employees instead of a billionaire private healthcare insurance program that's not a company of doctors and nurses, but just administrators that are deciding if we should get care or not, or that spend time delaying our ability to get care. $280,000 that could have gone into the pockets of everyday workers that went to a billionaire corporation instead.
That's a really good point. I think it's a piece of Medicare for All that people don't think about potentially. I think the estimate is that it would create almost 3 million jobs, first of all. And then just like the relief to small businesses, when you think about these small businesses who have to struggle to try and figure out how to insure their, potentially very tiny workforce, that's a huge burden off the shoulders of small business owners, which, we need a strong small business community to thrive. And then just in general, insurance tied to like employer-based insurances, like basing someone's access to insurance on whether or not they're currently employed. Again, I told that story about my family member who had that gap in coverage. It makes absolutely no sense, right? Medicare for All addresses a lot of things that I think people don't necessarily think about.
I just think about that dollar amount, the $280,000, what that would mean to a hotel worker, a janitor, to a nurse, to our ability to buy a home and feel secure and stable in the state of California, to have that flexibility to know that you can send your kid to childcare or to college, like what that would mean.
Yeah, that's life-changing, right? And the billionaires won't miss it, so.
The billionaires won't miss it. What continues to make this race so stark is that, again, we have a Democrat on one side who, by the way, was the only Democrat in the state legislature to vote against putting Prop 50 on the ballot. And then we have the Republican incumbent on the other side, Valadao, who voted to cut Medicaid, a program that 2/3 of his constituents are on. And in a district that overwhelmingly, again, voted for Bernie Sanders, who ran on a platform for Medicare for all. So this is what's on the line in 2026.
Wait, did you say the Democrat voted against Prop 50?
Baines was the only Democrat in the state legislature to vote against putting Prop 50 on the ballot.
I can't with these Democrats. I'm sorry to interrupt.
What's also crazy is that we have a supermajority of Democrats in both houses in California, unlike U.S. Congress. And we still weren't able to pass AB 14, CalCare, which would have established a Medicare for all in California, led by actually one of our Working Family Party champions, Assemblymember Ash Kalra. We couldn't even get that across the line with, again, a supermajority of Democrats in both houses and a Democratic governor that campaigned on Medicare for all, Gavin Newsom. We haven't seen any traction on that issue in the last 8 years, despite commitments from our elected leaders saying that they would fight for it. We haven't seen an inch move on this topic.
Yeah, it's back to what we were talking about, corporate Democrats. Democrats taking money from Big Pharma, from the hospital association. These Democrats are in bed with the wrong money, essentially. It always comes back to that, right?
So that's a perfect transition. Let's actually go to this interview with Randy Villegas and listen to what he has to say. Hi, Randy.
How are you doing, Jane?
Good. Welcome to our show, and thank you so much for joining us.
Thanks for having me.
So tell us where you are videoing in from.
I'm videoing in here from California's Central Valley and, just taking care of some work in between, campaigning, a full-time job, and the school board duties, and really excited to be with you all today.
So tell our listeners a little bit about who you are. So before you started running for office.
Before I was doing all these things, I was a young boy growing up in Bakersfield, California. First and foremost, I'm the son of immigrants from Mexico. My dad, Angel, my mother, Lucia, came here to this country to give my siblings and I, a better shot at opportunities to get an education. And like many families here in the Central Valley, my parents worked jobs that pay too damn little to put food on the table, to make sure we could afford groceries and rent and all these things. And so I grew up working. I grew up working at the swap meet every weekend, getting up every Sunday at 6 a.m. to go help my family. I later grew up working at my family's auto repair shop, which today I'm an owner of. And I grew up on programs like Medicaid and WIC. My mother was one of the 40,000 women in this district who relied on WIC to make sure she had baby formula for myself and my siblings. And so even though there was always a lot of love in the household, it was tough to get by sometimes. And so that's really what motivated me to start to question why things are the way they are in my community and the state and throughout the country. And that's kind of what launched me into politics. And today, running for Congress, the very same programs that I grew up on and wouldn't be here without today are all being cut because Valadao thinks it's more important to give tax breaks to billionaires like Elon Musk and Jeff Bezos than it is to support our working families here in the Central Valley.
So, Randy, this isn't the typical story of a lot of people that go into office, and certainly not people that run for Congress. How old were you when you decided to run for your first office? What was the first office? And why did you decide to do that?
The first office was really 2016. If I can call it an office, it was the Assembly Delegate elections for the California Democratic Party. And I had been inspired because this old guy from Vermont decided to come visit Bakersfield, California in 2016 when he was running for president, Theo Bernie. And I remember I was a community organizer at the time. I was a journalist. And so I got invited to this kind of private town hall before the really big rally where we could talk about our issues with the senator. And I just remember being so inspired that he gave us so much to believe in and that we don't have to settle for the status quo when it comes to politics, whether it's healthcare, housing, or education. So I decided to run for the ADEM elections to fight for a more progressive Democratic Party, a party that doesn't take corporate PAC money and that's actually working on behalf of working class people. At the time, I want to say I was at CSUB. I was maybe like 20 years old or so. And in terms of, political office, I ran for the Visalia Unified School Board and was elected at the age of 27.
So, Randy, why did you run for school board? This isn't something that many of us grow up aspiring to come, and it's certainly not something that you saw role modeled in your family or your community.
To be honest, I saw a little bit of the dysfunction on our school board. This was, during a time that we had COVID-19, right? And people were debating masks and vaccines and all these things. And there's an old saying that, your first school board meeting, you get sworn in, your next school board meeting, you get sworn at. And that was absolutely true. But I stepped up in this capacity because I was frustrated of seeing a school board that was debating whether or not climate change should be in school board policies as opposed to focusing on whether or not, our kids were reading at grade level. And so I wanted to step in because we needed to make sure we have a school board that was accountable, right, to our communities, to our students, and to all our faculty. School is a place where I found a lifeline, whether it was participating in band and sports and activities. And I wanted to make sure every kid in this community has even greater opportunities to be successful. So that's why I decided to run and step in. And it is tough work, but it's necessary work that needs to be done for our kids.
So, Randy, why are you running for Congress? Why now? And how old are you?
I'm 30 years old. I'll be turning 31 next month, actually. And I'm running because for far too long, the Valley's been left behind by politicians who care more about power than people and who are more interested in catering to corporations than our own communities. And, it was thinking right after the last November election, seeing the fear on so many people's faces and knowing what was to come. But it was also this big bullshit bill that Valadeo voted for that's going to cut billions of dollars from Medicaid, from SNAP, from WIC, from the programs that I grew up on and wouldn't be here without today because they think it's more important to give tax breaks to billionaires. And I think this really shows you why Congress's priorities are so messed up, right? We have a bunch of millionaires working on behalf of billionaires as opposed to prioritizing our working families.
I just looked up the stat. The average net worth of a member of US Congress is $1 million. And close to 50% of the members of Congress are millionaires. Now, this is not representative of our country. Millionaires are the minority, and yet they make up half of the members of US Congress, which means that very few of them grew up on programs like MIC, WIC, and Medicaid, like you brought up. Why is it so important to fight for Medicare for all? Because I saw that that's on your platform. What would that mean for folks in your community?
It would mean everything. As it stands right now, we have more Medicaid recipients in this district than anywhere else across the country. 2 out of every 3 individuals relies on Medicaid. And the fact that Valadeo voted for this bill is egregious. And, I think any Democrat would have said, I would have voted no on this bill. Of course, I would have voted no also. But let me tell you why we need Medicare for all. Let's talk about where we are right now before these cuts even go into effect, right? As it stands, 2 out of every 3 bankruptcies in this country are tied to medical debt. Every year, over 66,000 people die because they don't have health insurance, not because we couldn't treat them, not because we couldn't save them, but because of a system that denied them care. And so this is why we need Medicare for all. And it's also the financially responsible solution. I mean, we spend twice as much as other countries across the world on healthcare, despite the fact that they have better outcomes and manage to cover everyone, and we don't. And don't even get me started on dental and vision. I mean, people in my district will drive 7 hours to Tijuana to to go get cheaper dental work done and to go get cheaper prescription drugs, even people who have insurance here in the United States. And so it's ridiculous. This should not be happening in the richest country in the history of the world, and Medicare for all is the solution.
It's actually really shocking that we lead first world countries in preventable deaths, meaning deaths that could have been managed by a hospital, a doctor. We lead in those types of death amongst first world countries. And so we have some of the worst outcomes, yet spending more per person on healthcare. And, people often ask, well, how do you pay for it? Right? Like, what is your response when people ask you that? Like, yes, of course I support Medicare for all, but we can't afford
The question isn't really how can we afford it? The question is how can we not afford to do this? Because as we mentioned earlier, we're already spending twice as much as other countries across the world. We pay more for prescription drugs than other countries across the world. And the drugs aren't any different. It's the profits that these pharmaceutical companies are making, right? And these solutions, of course, we've got to acknowledge, are not going to come from politicians who are being bought off and paid for by Big Pharma and by these health insurance companies. I mean, to give you an example of that, both my Democratic and Republican opponent in this race received money from United Health, a corporation that was using AI algorithms to deny more people's claims so that they could continue to profit off of the suffering of our families. This is why we need Medicare for all. Nobody should be profiting from your suffering, and nobody should be profiting from your pain.
So let's actually talk about your opponents in the race. You are running against both an establishment Republican who sits in the seat and voted to strip healthcare from thousands of your neighbors and constituents. And on the other side, you are running against a corporate establishment Democrat who takes money from big oil and big pharma and is in fact a doctor. What has this fight been like for you?
It's been interesting to say the least. I did not see this, coming into this race as also being a fight for the soul of the Democratic Party, but that's where we are. I think we're in a moment where we have to decide whether we're going to be a party of the working class or we're going to be a party of the billionaires and the same corporate sponsors that are sponsoring my Republican opponent, right? And it is disappointing that, I'm running against somebody on the same party who doesn't believe that healthcare is a human right, who actually failed to show up for several bills in Sacramento when it came to pesticides and protecting our communities. And in a moment where, ICE agents are ripping apart families and refusing to identify themselves, California proposed a bill to have those ICE officers, unmask themselves and have to identify themselves. And she did not support that bill either. And I don't know how you can claim that you're going to fight against this administration if you're not willing to fight right now in this moment. I think that's what people are looking for. People who are going to fight for our constituents like their lives depend on it, because here in the Central Valley, they actually do.
So, one of the reasons why I'm at Working Families Party is that I have stopped seeing a distinction between the Democrats and Republicans. And while there are great Democrats in our party, like Bernie Sanders and AOC, who we talked about earlier, the vast majority doesn't seem to really distinguish themselves from Republicans. And one of the key critical problems with the two-party system currently is that both of them have been captured by billionaire corporations, and both of them view billionaires and billionaire corporations as critical to winning office and to staying in office. And I just think that if you are dependent on that type of big money, there's no way you can represent working people all the time. Maybe sometimes, but definitely not 100% of the time, which is what our country needs right now. And you come from a part of California that has really been, in many ways, overlooked. So for many of our listeners that may not be as familiar with Central Valley, tell us a little bit about Central Valley and what it was like to grow up here.
Yeah, the Central Valley is my home. I love it more than anything else except my wife and my family. And it is a place that has long been neglected, it's been overlooked, and it's been underinvested in by both politicians in Sacramento and Washington, D.C. Whether it's healthcare, whether it's job opportunities, whether it's educational opportunities. I mean, to give you an example of that, I teach at a community college. I'm a professor of political science. And 2 out of the 3 counties in this district do not have a 4-year public university. My students have to drive a minimum of 2 hours every day to either Bakersfield or Fresno to try and finish their bachelor's degrees. Every year we see headlines in the Central Valley that say, we have some of the least educated cities in the world. And that to me is not a reflection of intelligence. That to me is a lack of investment from Sacramento, from DC, who continue to neglect the Central Valley. And despite all the challenges we face here, both in terms of the political climate and the literal climate, you have some of the most resilient people in the world. Farm workers who get up every single morning to go feed the rest of the world while they struggle to feed their own families. People who literally feed and fuel the rest of the world, very humble people who just want government to work for them, not against them. And that's one of the reasons I'm running, is because, we deserve to have better opportunities here. We deserve better jobs. We deserve healthcare, housing, education opportunities that the rest of the state and the country have. And I'm going to fight like hell for every one of those things.
What kind of questions do people ask you when you talk about these dream policies that for some people may feel so remote and far away in the Valley?
Yeah, I think people are really interested in the how. And I think when they hear the how, they get a little excited. And they also say, well, this makes sense, right?
Well,
When
what
we
is
talk about
how? What do you say?
Yeah, so like housing, I think is a great example here, right? Everyone wants to talk about lowering the cost of housing. Obviously, we need to build more housing, but how else, are people facing a challenging market? Well, when I talk on the campaign trail or meet people at the door or at their homes, we talk about the fact that right now Wall Street is buying up entire neighborhoods across the United States and is trying to force people into becoming renters, right? And it's very simple. We actually have to prevent that. We want to ban. I will propose a bill to ban private corporations from buying up single family homes. These
Mhm.
corporations should not be buying homes before our family members can, right? You should not be having to, compete with an all cash offer from BlackRock or one of these corporations in order to afford your home, right? Or when we talk about healthcare, we talk about lowering prescription drug prices. When I tell them that if you drive across the border to Canada and stop at the first pharmacy you see to buy insulin, and how that insulin can only be $35 max, it's not a crazy solution. We can directly negotiate drug prices just like the VA does. So people get excited when they hear about the possibilities of change here in the Valley and across the country.
Something that I love that Working Families Party says is that we have been taught that government is the problem. And it's not to say that government has served us well, but when we view it as a problem, we give up on it. But that actually government is a prize that we should be fighting like hell for.
Absolutely.
You are probably at least a decade, if not more, younger than your two main opponents. What has it been like to be a young candidate and the type of support that you're getting, but also, the concerns that you get when people hear that you're 30 years old?
I think what's really interesting, earlier we were talking about how we have a bunch of millionaires working on behalf of billionaires in Congress. One thing that I really appreciated throughout this process is, unlike my opponents, I don't have to pretend to be from the working class. I don't have to
Mm.
pretend to know what about these issues because I've directly lived them. I've directly experienced them, right? Having to work multiple jobs, having to take care of family members, struggling to make ends meet. And while some may see my youth as something that people will criticize me for, right? I point out I have the experience, both in terms of being a local elected official. I have a PhD in political science. I've been working my entire life. I grew up here in the Valley, and people really resonate with that. And this district is actually a reflection of that. My family story, my story is not unique. There's so many other stories like this here in the Central Valley to be told, but we have too much talent that's trapped in poverty. But the median age of this district is only 30 years old, which is my age right now. And unlike other campaigns that only reach out and talk to the same voters every single year, this campaign is actually focused on expanding the electorate. So not only do we flip this seat, but we keep it in Democratic hands this time.
I mean, that was Zohran Mamdani's strategy in New York City, is that he wasn't going to go to the same electorate that always turns out for the mayor's race. He was going to expand it. And what we saw
Indeed.
in New York City was extraordinary. More young voters under 35 voted in the last primary in New York City than the other age groups combined. And that is very unusual. But he was able to inspire young folks to feel like they actually had a candidate to vote for. That it wasn't that young people were tuned out because they didn't care, but because they didn't have a candidate that they wanted to get behind. And I love that that's how you're going out and knocking on doors.
That's right. And if I could just add, I think what that campaign shows us truly, I know a lot of the pundits and folks will say like, it was social media, it was this, it was that, but truly it was a candidate and a campaign and a platform that people believed in, right? That actually gave them a reason to vote for rather than just vote against. And I think that's one of the things that we've consistently seen here as a failure in this district is we don't have a platform, a vision for people to believe in. And our campaign is relentlessly focused on affordability, on healthcare, on increasing opportunities for our families here in the Valley.
What are some of the most heartbreaking stories that you've heard at the doors or that you know personally in your community because we didn't have Medicare for all?
I've talked to people in this district, especially leading up to the vote on this big BS bill, people who've shared their stories, fighting cancer, fighting valley fever, being on the brink of death, and relying on Medicaid to make sure that they survived. I spoke to a mother who has a child with cancer, a pediatric cancer patient, right? Nobody should have to fight cancer and their congressman at the same time. We shouldn't have to fight for our basic needs and for our health to get better, right? And people also shouldn't have to worry about going tens or hundreds of thousands of dollars into debt just to get better, right? We need people to have the health care that they deserve, and we need to fight for Medicare for all. There's no other way that we can continue to have a system that prioritizes the profits of health insurance companies and big pharma and CEOs on the pain and suffering on the backs of our families. We deserve better here in the Valley and across the country.
You know what so many people don't realize is how much money health insurance makes without providing any care. It is $1 trillion industry that is not made up of doctors and nurses that then provide care and services. They're a completely separate corporation that just decides what type of care can be given despite not being doctors and nurses and doesn't actually provide it. So they have every interest to make sure that they provide the least services possible because that's an extra dollar for their CEO and their shareholders. And the other thing that I learned more recently is that those insurance companies that invest that in the market, that's actually where they're making all of their money. So they need all of those dollars that we pay in monthly premiums to then invest in the market to make trillions more. And it's just crazy to me that we have allowed an industry to grow that is not at all about providing care to our folks. And one story I'll share, last year was my friend went to his friend's sister funeral, someone who died of cancer in her 50s. And just a few days before the funeral, her sister got a letter approving her sister's chemo treatment. And, when you think about the rage that people held against their healthcare industry, I can't imagine how I'd feel getting a letter approving chemo treatment days after my sister passed away.
It's heartbreaking.
That is why it is so important to have candidates like you that are fearless, that are actually going to fight for us. How
Yeah,
many people
and
need to die before we change these policies?
you're right. It's infuriating. I think we need to ensure that we have a healthcare system that's actually providing for working class people and that's prioritizing health above profits and patients above profits ultimately. It's one of the reasons I applaud our nurses union for continuing leading the fight for single payer healthcare, both statewide and nationally. We need to continue to put the pressure on any elected official who is not supporting single payer healthcare.
And that's why Working Families is so excited to endorse you in this race, Randy, against both the Democratic and Republican establishment. And I know you also recently got the endorsement of Leaders We Deserve that is taking on the Democratic Party establishment as well, because we can't wait anymore. People are dying in our communities, and we need people like you fighting for us.
That's right. I'm honored to have, David Hawk's support and Leaders We Deserve. I think it's really important that we also acknowledge the generational change that we need in politics as well. And if we had more elected officials who are accountable to communities over corporations, the world would be a much more beautiful place. And we've got to get, corporate PAC money out of politics. We've got to overturn Citizens United, first of all, as well, right? It's ridiculous that billionaires and corporations can raise and spend unlimited amounts of money in these elections. But that's one of the reasons I tell my students, right, to exercise their vote, exercise your voice. If your vote didn't matter, these corporations and billionaires would not spend billions and billions of dollars every year trying to influence it.
All right. So, Randy, I also like to ask a couple of lightning round questions. So one of the questions I ask is, when you go into your YouTube or Spotify or Apple, what shows up as your most played artist?
Actually, was a bit surprised. I initially thought it was Childish Gambino, but it is The Voice right now, which is, kind of a spinoff of The Strokes a little bit.
Okay. What is your favorite national or state park in California?
Ooh, I would probably have to say the Sequoias, just having to be the gateway of the Sequoias here. Yeah.
Okay. Your favorite movie which takes place in the Central Valley?
McFarland. Every single time I watch it and rewatch it, it's just a beautiful film. Yeah, if you haven't seen it yet, McFarland USA.
And what is a sports team that you are ride or die for?
LAFC. LAFC. My older brother's an LAFC fan. My younger brother's an LA Galaxy fan. We've gone to the Tráfico game a few times, and it's always a great time.
What's the favorite thing that you are either listening to or watching or reading right now?
I would say I've been listening to a lot of Ivan Cornejo and Kevin Carl and just enjoying the music. When I have time, I love playing video games, but haven't had a whole lot of time to do that lately.
Randy, thank you so much for joining us today. I'm so excited about your race for Congress. It is such a hard and courageous thing to do. So thank you for doing it.
Thank you so much, Shane. And thank you all for tuning in and listening. For any of you who want to get tapped into the campaign, please head over to randy.vote/volunteer, randy.vote/donate. You can find us on all of our social media handles at villegasforcongress.com. Thank you so much for all the work you do, Jane, not just for the Working Families Party, but for our state, for our country.
Thanks, Randy. That's our show. If it helped, please share it with one person who needs the plain English version of this important topic. And join our Discord to keep the conversation going and to suggest topics for future episodes. The link is in the show notes. And follow us, California Working Families Party, on Instagram, TikTok, YouTube, and wherever you get your podcast. If you want to do more, DM us and we'll connect you with a local WP member rep to help organize your community or neighborhood. We got more information in the show notes. Rate and follow the show so you don't miss the next episode. I'm Shane Kim, and thank you for listening.